Hi, my name is Alexis, and this presentation focuses on nurse-to-patient communication in individuals with schizophrenia and how improving communication can enhance therapeutic interactions in psychiatric care. Nurse-to-patient communication is a core part of psychiatric care and plays a major role in patient outcomes. In individuals with schizophrenia, symptoms like disorganized thinking, impaired perception, and difficulty expressing thoughts can make communication more difficult. These barriers can affect trust and reduce a patient's ability to engage in treatment, which ultimately impacts the quality of care. The central focus of this study is nurse-to-patient communication in individuals with schizophrenia. Communication plays a key role in building trust and therapeutic relationships, and it also influences how actively patients participate in their care and how well they follow treatment plans. When communication is ineffective, it can lead to misunderstandings and can negatively impact outcomes. Research consistently shows that therapeutic communication is crucial in psychiatric settings, improving patient engagement and reducing distress. Patients report feeling more supported when nurses communicate clearly and show empathy. However, several barriers such as time constraints, environmental stress, and symptom severity can interfere with effective communication, according to Amoa and colleagues in 2019. Clinical complexity in psychiatric wards can further hinder interactions, according to Racy and colleagues in 2025. In restrictive environments, like high acuity units, communication opportunities are reduced, which may affect trust. Patients with schizophrenia value clear and direct communication about their diagnoses, but often feel the information is insufficient or poorly delivered, according to Luhind and colleagues in 2015. This highlights both the importance of communication and the ongoing challenges in psychiatric care. The purpose of this study is to explore nurse-to-patient communication experiences in individuals with schizophrenia and to identify strategies to improve therapeutic interactions. Understanding these experiences from both patient and nurse perspectives will help guide nursing practice and training, ultimately supporting better patient outcomes in psychiatric care. Patients with schizophrenia often face ineffective communication with nurses, which can lead to decreased trust, poor treatment adherence, and negative health outcomes. These communication difficulties can increase patient anxiety, contribute to misunderstandings about treatment, and affect the overall therapeutic relationship. Improving nurse-to-patient communication is essential for promoting positive patient experiences and successful engagement in treatment. This study seeks to answer, how does nurse-to-patient communication affect treatment engagement and patient experience in individuals with schizophrenia? This question will allow us to focus specifically on the communication dynamics that influence patient trust, adherence to treatment, and satisfaction with care. This study uses a qualitative research design, which is ideal for exploring personal experiences and perceptions in depth. Qualitative methods allow participants to describe their thoughts and feelings in their own words, providing rich insights into complex communication dynamics that cannot be captured with numbers alone. This approach is particularly appropriate for studying the nuanced interactions between nurses and patients with schizophrenia. The study will include adult patients diagnosed with schizophrenia and psychiatric nurses, providing insights from both perspectives. We will use a convenience sample of approximately 25 participants, including about 15 patients and 10 nurses. This allows us to explore how communication is perceived and enacted from different angles, ensuring the data reflects both experiences and professional perspectives. Semi-structured interviews will be used to collect in-depth information about how patients and nurses experience communication in psychiatric care settings. By using open-ended questions, participants are encouraged to describe their thoughts, their feelings, and their experiences in their own words, which allows for richer and more nuanced responses. The interviews will focus on the specific challenges participants face, including barriers to effective communication and strategies that they use to connect with one another. This method also allows the interviewer to ask follow-up questions, which is ideal for capturing the lived experiences of both patients and nurses and understanding the dynamics of therapeutic communication in psychiatric care. Qualitative data will be analyzed systematically to identify meaningful patterns and themes. Interview transcripts will be reviewed, and recurring ideas or themes, such as loneliness, will be grouped to create clear themes that reflect participants' perspectives. This process ensures that themes are accurately represented and that participant experiences, including their own direct quotes, provide depth to the findings. We're emphasizing that these themes are going to clearly be identified and pulled from participant responses, again showing how recurring ideas are grouped. Informed consent will be obtained from all participants before the study begins. This means that each participant will be fully informed about the purpose of the research, the study procedures, and their rights as participants. It will be clearly explained that they have the right to pause or end the interview at any time, and that choosing to participate or not will not affect the care they receive in any way. It will be asked to reiterate this to the nurse obtaining informed consent to ensure understanding. Additionally, staff may use clinical judgment to end the interview if a participant appears distressed, agitated, or unsafe. After the interview, participants will have the opportunity to decompress in a safe environment. Depending on unit scheduling, this may include attending a group activity, returning to the general milieu, or going to their rooms. During this time, participants will continue to be monitored for safety, and clinical staff will be available to provide support, answer questions, and ensure that the participants' emotional well-being is maintained. This approach ensures that the ethical and legal rights of this psychiatric population are fully protected, while allowing them to contribute meaningfully to the study. Data will be collected through semi-structured interviews with open-ended questions. Questions will be about nurse-to-patient interactions, perceptions of communication styles, trust, and engagement with treatment. Interviews will be audio recorded and then transcribed verbatim. This process ensures that participants' experiences are accurately captured and can be analyzed to identify patterns and themes. This study has the potential to improve nurse-to-patient communication strategies in psychiatric settings. Improved communication may increase patient trust, enhance treatment adherence, and reduce distress in individuals with schizophrenia. The findings can guide training and practice in nursing, ultimately contributing to better patient outcomes and a higher quality of psychiatric care. Nurse-to-patient communication plays a critical role in the care of individuals with schizophrenia. Understanding how communication affects treatment engagement and patient experiences will help identify strategies to improve therapeutic interactions. Strengthening communication in psychiatric care has the potential to increase patient engagement, promote better outcomes, and support effective, patient-centered care. Thank you for watching.